Welcome to Vet Neurojar, the podcast dedicated to exploring the intricacies of veterinary neurology. I am your host, ready to dive into fascinating topics that bridge the gap between cutting-edge research and clinical practice. Today, we are unpacking a recent study that sheds light on cervical hydrated nucleus pulposus extrusion, or HNPE, in dogs, differentiating it from other cervical myelopathies. Cervical myelopathy broadly refers to any disease or disorder affecting the spinal cord in the neck region. Among these, hydrated nucleus pulposus extrusion stands out due to its unique characteristics. The nucleus pulposus is the soft, gel-like center of an intervertebral disc, acting as a cushion between the vertebrae. In HNPE, the hydrated or non-degenerate portion of this nucleus pulposus extrudes, causing spinal cord compression. Think of it like a squishy ball suddenly bulging out and pressing on a critical structure. What makes HNPE different from other disc issues?
To diagnose it, veterinarians rely on magnetic resonance imaging, or MRI. On an MRI, HNPE typically appears as a ventral extradural lesion near an intervertebral disc, showing up as hyperintense on T2 weighted images and hypointense on T1 weighted images. This means it looks bright on certain MRI sequences and dark on others, helping radiologists identify it. Additional clues include a reduction in the volume of the nucleus pulposus, spinal cord compression, and sometimes a bilobed or seagull-shaped appearance of the extruded material. HNPE is predominantly found in the cervical vertebral column, which is the neck area, but it can less commonly occur in the thoracolumbar vertebral column, the area of the back. So, what does HNPE look like in a clinical setting?
Dogs with HNPE often present with less severe signs of pain compared to those with other intervertebral disc diseases or cervical spondylomyelopathy, also known as CSM. However, they tend to exhibit more severe neurological deficits, frequently manifesting as acute tetraparesis or tetraplegia. Tetraparesis refers to weakness in all four limbs, while tetraplegia is paralysis. Now, a key question in veterinary neurology is how HNPE compares to other causes of cervical myelopathy. To address this, researchers conducted a retrospective study at Cornell University Hospital for Animals, looking at data from 2010 to 2022. The study included 377 client-owned dogs diagnosed via MRI with HNPE, intervertebral disc extrusion, or IVDE, fibrocartilaginous embolic myelopathy, or FCEM, CSM, or neoplasia. Neoplasia refers to the presence of tumors. Let us delve into the methods of this study. The researchers meticulously reviewed the Cornell University Hospital for Animals picture archiving and communications system to identify dogs that had undergone cervical MRIs. To be included, these dogs needed an MRI report reviewed by a board-certified radiologist, confirming one of the 5 diagnoses, which are HNPE, IVDE, FCEM, CSM, or neoplasia. The team then scoured the medical records, extracting data on demographics like age, weight, sex, and breed. They also noted the vertebral lesion level, whether the dog had medical or surgical management, the type of surgical procedure performed, and if mechanical ventilation was necessary. Crucially, the researchers collected data from the initial neurological examination. This included the modified Frankel score, or MFS, a system for grading the severity of spinal cord injury. Pain scores, signs of central cord syndrome, and whether the signs of myelopathy were lateralizing, meaning more pronounced on one side of the body, were also recorded. Let's break down these clinical assessments. The modified Frankel score, or MFS, is a valuable tool for assessing the severity of spinal cord injuries. In this study, a score of 0 meant the dog was tetraplegic and lacked deep pain sensation, while a score of 1 indicated tetraplegia, but with intact deep pain. A score of 2 signified non-ambulatory tetraparesis, meaning the dog could not walk on its own, and a score of 3 meant the dog had ambulatory tetraparesis, or weakness in all 4 limbs, but was still able to walk. A score of 4 indicated cervical hyperesthesia only, meaning increased sensitivity or pain in the neck region, and a score of 5 meant the dog was neurologically normal. Pain was carefully scored based on the dog's reaction to cervical palpation. A score of 0 meant no reaction was elicited. 1 indicated mild tensing or resistance to neck movement. 2 meant moderate tensing, and 3 represented a severe reaction, spontaneous fasciculations, or vocalization. The MRIs in this study were performed using a 1.5 Tesla Toshiba Vantage Atlas MRI unit. Each MRI protocol included sagittal and transverse T2 weighted images and pre-contrast T1 weighted images as a minimum. Depending on the case, Additional sequences like short tau inversion recovery, gradient echo, and post-contrast T1 weighted images were included. With all the data collected, the dogs were then classified into one of the 5 diagnostic groups, which are HNP, IVDE, FCEM, CSM, and neoplasia. Statistical analysis was performed using Stata software to identify significant differences between the groups. Bivariate analysis, using Wilcoxon rank sum test for continuous variables and chi-squared or Fisher's exact test for categorical variables, was used to compare characteristics between HNP and other cervical myelopathies. The likelihood of needing mechanical ventilation in dogs with IVDE versus HNP was also calculated as an odds ratio. Now, let's dive into the results. The HNP group comprised 26 males and 20 spayed females, with mixed breed dogs, dachshunds, and beagles being the most common breeds. The median age of dogs with HNP was 10 years, with a median weight of 9.1 kilograms. The researchers found that breeds did indeed differ in their likelihood of being diagnosed with specific cervical myelopathies. For example, no French bulldogs were diagnosed with HNP, whereas they were frequently diagnosed with IVD. All golden retrievers and miniature schnauzers with cervical myelopathy were diagnosed with neoplasia. Doberman pinschers were equally likely to be diagnosed with either IVD or HNP compared to CSM. A key finding was that dogs with HNP were older and of lower weight compared to dogs with IVD, FCEM, CSM, and neoplasia. The median age of HNP dogs was significantly higher than those with IVD, FCEM, and CSM. HNP dogs also weighed less than those with CSM and neoplasia. Let us turn our attention to the clinical findings. A significant portion of dogs with HNP, 58%, had either no apparent pain or only mild tensing on cervical palpation. A large majority, 89%, presented as non-ambulatory and 35% showed signs of central cord syndrome. Furthermore, 65% had non-lateralizing signs of myelopathy. When comparing initial neurological examination findings, dogs with HNP were more likely to present with non-lateralizing signs of myelopathy, signs of central cord syndrome, and a non-ambulatory status compared to the combined group of dogs with other cervical myelopathies. Specifically, they had lower pain scores than dogs with IVD, but higher pain scores than those with FCEM. Dogs with HNP were more likely to show signs of central cord syndrome than dogs with IVD, FCEM, and CSM. They were also more likely to be non-ambulatory and have a more severe modified Frankel score than dogs with IVD, CSM, and neoplasia. Regarding lesion locations, MRI revealed that dogs with HNP most commonly had vertebral lesions at the C3-C4 and C4-C5 levels. These are specific locations on the vertebrae in the neck. The distribution of lesion locations did not significantly differ between dogs with HNP and those with IVD. Interestingly, dogs with HNP were more likely to be treated medically compared to those with IVD, as most dogs with IVD underwent surgical treatment. Surgical procedures for HNP, IVD, CSM, and neoplasia included dorsal laminectomies and ventral slots. Now, one of the most striking findings of this study was the difference in the need for mechanical ventilation. Mechanical ventilation was utilized more frequently in dogs with HNP than in dogs with IVD. Specifically, dogs with HNP were 9 times more likely to require mechanical ventilation compared to dogs with IVD. Survival to discharge following ventilation was 50%. The breeds that required mechanical ventilation varied, including mixed breed dogs, dachshunds, and a Labrador retriever. All ventilated dogs had a modified Frankel score of 1, indicating tetraplegia with deep pain present. The dogs that survived following ventilation and surgery showed improvement in their modified Frankel scores, although the time to regain ambulation was longer compared to previous studies of HNP dogs that did not require ventilation. The study had several limitations. Being a retrospective study conducted at an academic institution, there might have been a higher likelihood of offering ventilation compared to other centers. The sample sizes, especially for certain subgroups, were relatively small, and the study did not include all types of cervical myelopathies. The retrospective nature also meant that detailed information on the onset and progression of signs was not consistently available. In conclusion, this study highlights important differences in clinical characteristics between dogs with HNP and those with other causes of cervical myelopathy. Dogs with HNP tend to be older and of lower weight. They are also more likely to present with non-lateralizing signs of myelopathy and signs of central cord syndrome. Most importantly, they have a significantly higher likelihood of requiring mechanical ventilation. These findings provide valuable insights for clinicians. When faced with a dog presenting signs of cervical myelopathy, considering these differences can aid in prioritizing differential diagnoses, making informed case management decisions, and guiding discussions with owners regarding potential outcomes, including the possibility of needing ventilatory support. That wraps up our discussion on cervical hydrated nucleus pulposus extrusion in dogs. Thank you for joining me on Vet NeuroJar. Until next time, remember to keep those minds inspired, hearts light, and tails wagging.